The following events are a fictionalized representation of what could happen at any OrthoCarolina location. Today, Brandon Para will be a patient at OrthoCarolina. Brandon is being seen by Dr. Stanley for a knee injection. On his way in, Brandon sees a piece of trash and without thinking picks it up. But what Brandon didn't realize is that piece of trash has germs on it, which he is now carrying into the clinic. The OrthoCarolina front desk does not realize Brandon just picked up germs. As Brandon checks in and exchanges his insurance card and ID, he passes on his germs and may pick up other germs throughout this check-in. Brandon takes the iPad, and it looks like the last patient left behind some germs for Brandon to pick up. All kinds of patients sit in the waiting room, and any of them could have left behind yet another germ for Brandon to come into contact with. Even though this is an orthopedic clinic, other patients could have a multitude of germs, and anyone, patient or staff, could pick up these when proper sanitation techniques are not used. Brandon's nurse calls him back. Someone left a germ for Nurse Seth to pick up, and once again, Brandon receives another germ.
Blood pressure?
Nurse Seth takes Brandon's blood pressure, but the cuff has not been cleaned recently, and Brandon is exposed to more germs.
I can take that iPad from you. Alright, the doctor will be in shortly. Thanks.
Nurse Seth takes the iPad and has now been exposed to the germs Brandon has picked up throughout his visit.
Alright, Brandon and
Although Dr. Stanley just washed his hands, he is about to be exposed to Brandon's germs. Dr. Stanley has unknowingly transferred these germs to the injection tray.
Hey Brandon, you ready for your injection?
Yes, sir.
How could this have been prevented? OrthoCarolina has a clear set of policies and procedures about hand hygiene. Employees should wash their hands at the beginning and end of work, before and after using the bathroom, eating, or taking any kind of break. Staff should clean their hands after glove use and between each patient. Proper hand washing procedure is illustrated by Dr. O'Neill. Wash hands and wrists with soap for 15 seconds, and make sure to clean the fingers and the backs of the hands. Singing happy birthday while washing is a good marker for time. Use a paper towel to dry hands. Turn off the sink using a dry paper towel. Another quick and accessible way for the staff to clean their hands is using foam that should be placed on the wall in every exam room. Dispense the foam into hands and rub until hands are dry. One last way to sanitize the hands is to use the gel that is placed throughout OrthoCarolina clinics. Like the foam, employees should dispense gel into hands and rub hands until dry. Remember this acronym, WASH and foam. We all scrub hands for others and myself. Hand hygiene is important to staff and patients. Full compliance is required of all staff to avoid spreading germs.